Today, I'm joined by Jim O'Brien, Product Strategy Senior Director at Cigna Healthcare, who's focused on Cigna's affordability measures that are best positioned to support you and your organization. Jim, welcome, and thanks so much for joining us today.
Hey, Jeff, thanks for having me. It's great to spend some time with you.
So I think most of our audience is aware that employers and their employees are dealing with the rising cost of healthcare, increasing over the past few decades to now 18% of GDP in 2021. Despite available solutions such as primary, virtual, and behavioral care, as well as home-based care, total healthcare costs are continuing to climb, in part due to lack of awareness and utilization. So, Jim, how is your team looking at this and its impact to our clients' organizations and ultimately their bottom line?
Absolutely. Let me get into two topics here. We'll talk about sites of care as well as virtual care in particular. So we talk about sites of care in terms of the use of emergency rooms, many times used in cases that are less than emergent, really could be cared for by other sites and locations. There's also the appropriateness of urgent care and versus a primary care visit. But most importantly, I would say, is in the virtual care space. Cigna's invested quite a bit in our MD Live partnership, really looking to create some availability for virtual care because of the convenience it offers to customers, as well as the cost savings it offers to both customers and employer clients. Virtual care can be used for non-emergent conditions such as coughs, sore throats, and eye infections, and it really enables a convenient and quick access to care with less time out of work for an employee. It's affordable because the care is delivered without the same infrastructure that bricks and mortar care is provided with. And it's simple. It's a couple clicks away and you're engaged with a doctor. And it works with the schedule of most employees, which is really important to have that convenient access. Most importantly, in terms of virtual care, is that it's not just for those colds and coughs and reactive, but you can actually use it for primary care help, for dermatology visits, preventive care, psychiatric care, and working with licensed therapists and counselors to get that full behavioral solution. So it's really a very comprehensive offering.
That's very helpful, Jim. And can you talk a bit about what Cigna Healthcare is doing to make care more affordable?
Absolutely. So diving into two areas of cost, I'll say pharmacy being one, and then MSK or musculoskeletal care. So the pharmacy side, Cigna is investing a lot in improving lowest net cost formulary solutions, as well as utilization management programs. And these are designed to really eliminate or reduce the use of low value, high cost drugs and get clients and customers to increase their utilization of higher value, perhaps biosimilars or generic medications that offer a lot of the same clinical advantages as these more high priced low value options. In addition to that, it's important to consider the fact that the high cost brands that have available alternatives can be guided away using those formulary or utilization management techniques. In the case of musculoskeletal care and generally around planned procedures, so any types of surgical intervention that can be planned for in advance, the decision on the right physician to work with and the right facility to have the care delivered at has a significant impact on quality outcomes for a patient, as well as for overall affordability and costs. And the Pathwell Bone and Joint program that Cigna is offering in 2024 is really designed to make that process very easy for a patient who's navigating the often complex options available to them. And this is inclusive of not just a surgical intervention, but also lower cost and equally effective solutions such as physical therapy and other pain management techniques. McKinsey actually just came out with an article here in September that passed along information around the importance of creating pathways for customers to both improve their experience with the healthcare system as well as drive affordable and quality outcomes.
Thanks, Jim. And another part of the affordability trend we're seeing is that some employees are delaying or avoiding necessary care altogether, leading to worsened health, decreased productivity, and higher healthcare costs when they do need care. Can you briefly discuss some of the actions Cigna Healthcare has taken to address this?
I think the importance of preventive care, and specifically I'm going to call out preventive dental care, is really critical for patients and customers in general. It's not just important for oral health, but has connections to overall physical health and well-being as well. So practicing good preventive dental care has been shown in a number of studies to reduce ER visits by 36% and reduce hospital admission rates by 39%. So these are really significant improvements in overall healthcare associated with good preventive dental care. In addition, customers who had gum disease and so actually had a challenge there they needed to get treatment for and saw treatment had a significant reduction in overall medical costs, $375 PMPY, or 6% in year one and up to 8% in year two. So really significant financial gains in addition to the quality and the health outcome improvement for that customer. And in addition to the dental side, the importance of getting your annual physical on the medical side is also really critical and has lots of positive outcomes in terms of identifying larger issues earlier on and being much more preventive oriented.
Thanks, Jim. Clearly, there's so much to talk about when it comes to affordability in healthcare. But for now, thanks for sharing some of those insights, Jim, around this trend clients can be on the lookout for in 2024.
Thanks very much, Jeff. I really had the excited to have the opportunity to talk to you about these important topics today and look forward to more in the future.
And to our listeners, thank you so much for tuning in, being such a valued partner. As your consultative growth partner, we're invested in the health and productivity of your employees and your organization's success. We look forward to sharing more information on these key 2024 trends and more topics like them with you in the future. We know the healthcare ecosystem can feel complex and uncertain at times, but we're focused on helping you and your employees navigate what's ahead. We have a plan, and as your partner, we'll be by your side every step of the way.